My name is Rennie Grant. I am a drug and alcohol counselor with Colmac. I am a musician and longtime music producer, and they call me Roc.
All right, ready? I'm Tony Massey, a psychiatrist, addiction medicine specialist, also at Colmac, and people call me Doc.
Okay. So now you know who we are, and so this is the second part of our question. So this is a question from Jim. Okay, and Jim is asking us. He says, "Well, I'll read you the question." He says, "Roc Doc, hi guys, my name is Jim, and I am 6 months clean from heroin."
Great.
So 6 months. That's kind of over the hump, you know. So good job.
Great.
Yeah, excellent. I go to tons of NA meetings. So that's awesome. You know, 90 and 90, and some people do 120 and 120 and all that.
Yep.
He apparently has a therapist because he says my therapist wants me to see a doc. I imagine a psychiatrist for medication to treat my depression. So I guess he's got a co-occurring depressive disorder. We don't know which one.
I know that happens a lot.
Yeah. It's hard to do this because we're not talking to you and we don't know, what are the features of it. But
It never stops us from having an opinion.
True. Very true. We don't need any information to diagnose anyone. I don't want to take any medications. I'm done putting things in my body. And that is just absolutely what I hear so much at Colmac. I've been doing this for so long. I've been taking drugs. I don't want to take any more drugs. Yeah. Which is that's an admirable thought. What do you guys think? So he just opened up the door for us to sort of
go to town.
Postulate.
Yeah. But you have some thoughts.
I guess I do. I always do. So the phrase "I'm done putting things in my body," that right there is sort of a warning sign to me.
Okay.
And I'll tell you why. Because, if he's seeing a therapist, and if you're seeing a therapist, right, and your therapist is a licensed, trained professional, hopefully in the state of Maryland they are, right? If they're advising you to do something to treat your mental health disorder, whatever it is, they're seeing something that's distressing to them, right? And I think it's sort of, the job of the patient to say, you know what, there might be something to this. Let me at least, examine it. Because, in early recovery and with addiction, writing our own prescription and creating our own treatment plans, that's like what we do. I like that, but I'm not so sure about that.
Yeah, kind of the DIY approach to
like I'm going to go to meetings. I'm not going to work steps or get a sponsor or talk to anyone. I'm just going to sit in the back row. But it's not working for me.
Yeah, I like step 3, 7, and 9.
Right.
Those are the ones I'm going to do.
But I'm not going to do the rest. But what happens with those people, and I'm generalizing, but oftentimes, more often than not, is they relapse, right? Because they're not looking at their condition, from a whole perspective, a global perspective. So that's sort of like a scary thing to me,
Well, I am a psychiatrist and see just, patients who don't have comorbid addictions as well as patients who do. And a lot of people don't want to take medicines.
What do they say? What's their response? Similar?
They don't want to take meds. Is there something I can do that's not medication? And for depression there is, and and maybe you and your therapist have already, kind of discussed this.
You mean like mindful,
holistic psychotherapy.
Yeah.
Obviously
he's doing that.
He's doing it, and still the therapist is sort of saying, not there.
So what would cause that to be? When does the therapist say to their patient, "This isn't working. You need more help"?
Well, if someone's not improving or getting worse after several sessions, a good therapist will just sort of reevaluate things. And is there something that's happening here in therapy that's not going right, or is it maybe just this is one of those cases where you need to have extra.
Could be a chemical thing that psychotherapy can't change.
So there's and other we can just go over the other non-medication treatments for depression. Exercise, getting enough sleep, nutrition, hydration, mindfulness. You mentioned that.
I'm big on that. That's one of my favorite. It's kind of saved me.
So you do these things and you still have symptoms, then maybe you need to look at medications or I suppose I guess there are a couple other non-medication treatments still. There's electroconvulsive therapy. There's no medicines.
But
There's anesthesia medicines with that. So.
wouldn't the electroshock be sort of like, that's kind of an extreme treatment?
That's an extreme treatment.
It works though, but I think you have to be sort of far along the spectrum of suffering.
Yeah. And then there's TMS, or transcranial magnetic stimulation.
Oh yeah, I heard about that too.
So, but usually that's after you don't do well with medications, because there's a real time commitment to that, and
you have to do that several times a week.
Yeah, for quite some time. So it's not as it's something that you would want to do in case other things that are a little bit simpler and easier don't work.
Gotcha.
So then it's kind of medications, and it's funny, the people who don't want to put anything in their body may be taking meds for blood pressure, for cholesterol.
Right.
If they have like a skin infection, they may take an antibiotic. So it's really
and they're not going to complain about that.
Right. Yeah. So it's really the psychiatric meds that people have
that's funny.
worries about. So
that he says he goes to a lot of NA meetings, and it could also be like 12-step groups have a reputation for like poo-pooing psych meds, right? The Suboxone thing, which isn't a psych med, but the psych, like MAT and psych meds, like that's
work
not
your
being
recovery, your mood will get better.
Right. If you're not, maybe you're not working your program good enough or well enough, and so that's a fallacy. It's not true, and it's actually, I think, harmful to some people because it pushes them away from recovery.
The vast majority of meetings aren't like that. It's local.
No.
Each one is your kind of local personality.
Yeah, I'm not. I go to NA myself, so I'm not saying the whole program, but there are individuals in the program who take the whole like abstinence thing, like you can't take anything, and we're here to tell you that that's not the case, right?
Yeah.
So I don't know. I think that it looks to me like, again, he's trying to write, or I'll speak to you, Jim. You're trying to write your own prescription for recovery, and I think that. At least examining the need, right? If you really don't want to take it, what are you doing outside of just going to your therapist, right? So maybe you could include holistic practice like acupuncture, even deep tissue massage, Reiki, things like that. Or are you biking? Are you exercising enough?
Yeah, the cardiovascular exercise is really good evidence supporting, how the effect on mood. So
has he exhausted all of his other options first?
Yeah. And then, if you have, and it's kind of, your therapist is saying, consider, talking to somebody, maybe a medication, then it's really, there needs to be a bit of a acceptance, or maybe letting go of this idea that, you can handle it all and don't need, something like a medicine to, help you out,
It's an interesting point. Maybe he feels broken.
Yeah,
there's something wrong with me if I got to take meds.
Yeah.
I
mean, that's a real
shouldn't have to.
Right, and a lot of people feel like, if they're taking medicines for depression, every day they take a med reminding them they're this weak and broken and whatever, and they're dependent on the medicine and this kind of thing. And nobody says that about insulin, but if you don't take your insulin and you're diabetic, then you die. Yeah. So I mean, you are dependent on the insulin 100%.
And if you don't treat your depression, chances of relapse are far higher. And I think with heroin, especially now, I mean, relapse for many people equals death.
Yeah. So yeah, I think the stakes are pretty high here, Jim. I think, hearing what experts around you are saying, and maybe sort of, working with your therapist to sort of explore what a medication would mean to you. What would you have to let go of? What would that mean if you were taking a medication?
Yeah.
And that's totally, grist for the mill for therapy, I think.
Absolutely, and if you make an appointment with your doc or your psychiatrist, there's so many different options medically, or as far as medications are concerned. Finding ones that maybe the least side effects. You can try different ones. There's so many options.
That's right.
And you're not like locked into one thing. And I think that's one of the good things now is we have so many options medically.